Good evening. This is the Greenfield Public Schools Special School Committee meeting. It's Thursday, March 3rd, 2022, 7:30 p.m. I'm sorry, 7:45 p.m. This meeting is being held fully remotely in accordance with the Governor of Massachusetts March 12, 2020 order, suspending certain provisions of the Open Meeting Law, GLC 30A, Section 20. And we're going to go right into our agenda. Let's do a roll call and call to order, please. Secretary Ekstrom.
Thank you. Member Johnson-Masad?
Here.
Chair Peretti?
I am here.
Mayor Wiedegartner?
I do not see her on yet.
I see her, but I'm not hearing her.
Okay. Oh, she's under the city. I will fix that. You should be able to unmute, Mayor.
Hi.
Thank you.
You're here?
You're unmuted now. I would suggest you leave it unmuted if you can.
Secretary Ekstrom, I'm here. Member Wall?
I don't. Oh, I do see Jean.
Vice
I'm
Chair
unmuting
Wall.
her now.
My apologies.
Jean, you'll have to click to unmute.
Here.
There you go.
Welcome, Jean. Member Deneve?
She's also here. She should be able to indicate in a second.
Here.
Thank you. And Member Martini?
Here.
Thank you. Just so everyone's aware, those are in no particular order other than the way I wrote them down.
And we have a quorum.
We do have a quorum. My apologies. We are all present.
And we call it to order at 7:47 p.m. We are going to move in right into our face covering policy. What I'm first going to do before we get into discussion, a motion and discussion, is I'm going to try to share. We just a couple hours ago or less received an updated face covering policy based on new guidance from both DESE and the state that includes both guidance for buildings and buses. And this is updated from MASC and reviewed by both myself and the superintendent, who I'm going to share this now. Give me 1 second.
I'm going to unpack some of the alphabet soup for the good of the public there. Desi is the
Please go ahead. I'm sorry, my screen is freezing up. Go ahead and do that, please. Thank you, Member Johnson.
Desi is the Department of Elementary and Secondary Education. MASC is the Massachusetts Association of School Committees. I think there was one more, but I don't remember what it was.
I don't know. I think that was it. I should be able to share now. Sorry, I know I'm getting warnings that there are some video issues. And I have clicked to the share button, but nothing is happening to show everyone the updated policy. I guess what I could do instead, Superintendent.
It looks like I could share it, actually.
Oh, can you try, Glenn? Because I'm not able. My screen is a mess of warnings.
To pull it up. I think I had it here.
If you can't, Glenn, I can.
Okay.
So just let me know.
We'll make it a race.
I'm not that concerned.
All right, I'm just pulling it up. All right, now I have it open up and I can just try to share.
Great, thank you. I think it's working. Is anyone seeing it yet?
There it is. Well done, Glenn. Thank you.
Thank you, Glenn. So it is very similar to the policy we had in place in terms of the only the areas that it addresses. It is not similar in terms of actual face masking. So now that we have this shared, everyone can hopefully see it. Let's have a motion regarding our masking policy from anyone.
Before we have the motion, we should probably decide, I'm assuming we want to adopt the policy on the first reading and then bring it back for an affirmation reading. In other words, to adopt it on an emergency basis.
Yeah, I do agree. That's a good thing. And so we should vote on the waiving the second reading. Is that right?
No, essentially, we adopt it on the first reading, and then our policy requires us to bring it back for an affirmation.
Okay, so we could affirm on Wednesday the 9th next week.
Mm-hmm.
Thank you, Glenn. That's totally fine. Okay, so anyone ready to give a motion? I can certainly try one. I'd love for it to come from someone besides me.
Chair, let me just ask a question. Is it that do we need to do two things? One is repeal what was there previously in order to be able to adopt a new
I don't think
something?
so. I didn't mean to interrupt you. I don't think so because the policy has the same file name, right?
Okay.
EBCFA, isn't that
Okay.
right? And we're really just replacing one with the other, so I think you could cover that in the motion unless
Okay.
someone who's going to make the motion disagrees.
Okay. Well, all right. Anyone? I'll take a shot. Excuse me, guys. Help me out if I miss something.
Sure.
Motion to replace the current file EBCFWay with the revised as of March 3, 2022 file EBCFA. Did I cover it?
I believe so. Let's have a second and then we can address it if we don't. And that was a motion by member Ekstrom. Is there a second? Was that member Wall?
Yes.
Thank
Member
you.
Wall with the second. And let's have discussion, please. You may have to raise your hands. I think it's probably my computer, but I don't see anyone's picture. So please just speak up and we'll try to keep it civil.
If I stop sharing, does that make it more possible for people to see other people and who's raising their hand and everything?
I don't know.
Well,
It may be me that's having trouble. My computer has pretty much frozen up. I know you can still see and hear me, but I can't see or hear anyone.
all right, let me ask this question. Since this is being something that has to be replaced, and if we're having some screen issues, are there any objections to me just reading this out loud so that we're certain is clear on what is there?
Please
I think
do.
I have no objection to that. I think that's
Okay.
fine.
Okay. So, Susan,
Glenn, do you
this
mind
is
stopping sharing? We'll see if that helps.
no, because I need to read it.
Oh,
And
sorry.
then-
You don't have it because it was
I
sent
do
to me.
have it, but I
Okay.
think it's probably better if I'm reading it and everyone sees what I'm
Sorry.
reading.
Okay,
just
go ahead.
posterity's sake.
I'll shut up.
Susan Farber, in the event you haven't recognized me, this is Secretary Ekstrom. And I am going to be reading the proposed file EBCFA face coverings. The Greenfield Public School District is committed to providing a safe environment in schools during the ongoing COVID-19 pandemic. Maintaining a safe environment is critical to the district's ability to ensure students remain in a full-time classroom learning environment. According to public health experts, one of the best ways to stop the spread of coronavirus and to keep members of our school community safe is the use of face masks or face coverings. Therefore, in accordance with guidance and recommendations from the Center for Disease Control, CDC, the Department of Elementary and Secondary Education, DESE, or DESE, for those who are playing along, and the Massachusetts Department of Public Health, DPH, the following requirements are in place until further notice. A face covering that covers the nose and mouth is strongly recommended to be worn by individuals who remain unvaccinated or are otherwise immunocompromised in school buildings and on school grounds, even when social distancing is observed. Individuals who are vaccinated are not required to wear a mask, but may do so if desired. Students and staff returning from 5-day quarantine following a positive COVID test must follow strict mask use, other than when eating, drinking, or outside, and conduct active monitoring for symptoms through day 10 of exposure. Masks will be required in all school health offices. Masks are not required on school buses unless a private transportation company utilized by the Greenfield Public Schools adopts policy that requires them. Guidance statements, Massachusetts Department of Public Health, And there's the link. Let's please not make me do that.
I think that's fine.
Okay. And there are several other links, and there they are.
Thank you.
Thank you, Glenn. I appreciate it.
Yes, thank you, Glenn. I can't tell if you stopped sharing because, like I said, the rest of my screen is frozen.
Yes.
Okay, so let's have some discussion. If either Secretary Ekstrom or Vice Chair Wall is able to actually see the school committee members, I would actually have them run the meeting because I can't see anyone except myself for whatever's happening with my PC.
So that's okay. I can do that.
Great, thank you.
I'll try.
So we're looking for discussion. Any discussion?
Actually, yes, me if no one else is.
I'll recognize you and then
like to
we
go.
can move on. Yep, go ahead.
Thank you. I actually want to unpack this a little bit as we're reading it. A face covering that covers the nose and mouth is strongly recommended to be worn by individuals who remain unvaccinated and are otherwise immunocompromised in school buildings and on school grounds, even when social distancing is observed. So my question, I guess, is have we tracked who is or is not vaccinated? And have we tracked those who are immunocompromised? And this would apply to both teachers and students. And this is a lot of questions. Sorry, Superintendent, I can see you. And aside from the nurse, how is it appropriate that anyone outside of the nurse would, how could it be appropriate that anyone outside of the nurse could have that information based on HIPAA laws? That's my question.
You're muted, Superintendent. I think that
she's muted. Oh, geez. I can't see anything anymore.
Wait.
Ekstrom, you're a co-host.
I got it.
There you go.
Thank you.
Yep.
No one outside of our nursing staff in individual buildings is aware of the medical status of any of our staff or students, nor is anyone aware of the vaccination status of staff or students unless those staff or students share it themselves. This would be, the language of this draft policy says it's a recommendation for those who are immunocompromised or unvaccinated to mask. So it would be up to them to follow the recommendation if they so choose. We feel strongly that it would be up to individuals or certainly the families of minors to request their children wear a mask if the need arises. We expect that families and students will follow the rule of masking after day 5, but we also expect that anyone who is still demonstrating symptoms after day 5 would remain at home.
So your thought is it, may I follow up on that?
Of course.
Chair, is that all right? So, and I don't ask about how this would be administered by any means, but so it sounds like your thought would be that it would be more of an honor system unless someone has openly shared that information. Okay. Just want to make sure I'm clear. That's fine. I'm just.
Yep.
I mean, I think that.
Oh, I'm sorry.
No, I'm sorry. Go ahead.
Really much like the status of any other medically based accommodation for any of our staff or students. That's really a conversation between the nursing staff and those individuals. So we would leave it in that same respect.
Perfect. I didn't want to know any more than I needed to know. Thank you.
Thank you. Other questions, other discussion?
I have a comment.
Go ahead.
I'm supportive of adopting this policy, but I want to talk a little bit about the bigger picture because I think we're still at a phase in the pandemic when masking in a big congregate setting like a public school makes a ton of sense. But one of the ways I'm kind of looking at this is that masking has been almost like unfunded mandate. We didn't have the robust federal response to this pandemic that we really needed to have the space and the staff to be able to have the students spread out, to be able to have the staff available to help people to adhere to a masking policy. I know that I think there's still many medically vulnerable people, and we're still really not out of the woods yet with this pandemic. And I think I honestly think it's a little bit sad that we're reached this place where we just don't have we've never really had the resources to make a mask mandate work. I thought some of the most compelling things I've read in the many emails and the part of public comment that we did hear yesterday was just imagining that cafeteria full of students taking off their masks to eat. It's like it becomes almost farcical, and I don't really want to participate in that. But I do think we do need to face the fact that there's a big failure here in our country to address this pandemic the way that it needed to be addressed. The vaccination rates are dismal. The amount of resources that were put into schools to help get us through this in a safe way is totally inadequate. And but I just think it's silly to keep beating our heads against the wall for a policy that's impossible to enforce. And we saw for ourselves how impossible it is to enforce a mask policy the other night. So that's why I'm voting for it. I'm wishing that we were in a
Thank
place
you.
where we
I
could
appreciate that, Glenn.
all come. Just let me one more sentence. Just I wish we were all in a place where we could come together and take care of our neighbors by all wearing masks for a little bit longer, but I just don't think we're there.
Any other comments?
Mayor Rita
Are
Gardner.
you guys able? Are you all able to hear me?
I am.
Yes.
Okay. Okay. Any other questions or comments from the school committee?
Mayor Rita Gardner.
Please go ahead.
What's important to me in this policy, as I recall that it was stated, is that for those people that really want their children to wear masks to the schools, that they are able to do that and that they are supported by the staff in that, because that is very important. We don't know who's immunocompromised. Our nursing staff may know that, and many other things. So I just want to make sure that if we go forward with this, lifting the mask mandate, that we make sure that those who come to schools with masks on are supported. And I believe that that is the appropriate way to proceed. I have no problem with the policy as it is stated. I think it's very comprehensive and covers what needs to happen going forward.
Thank you, Mayor Rudiger.
May I say something? This is
Please. Vice Chair Wall, go ahead.
I agree with the mayor that children should be able to wear masks. And I have a friend who teaches in a school in Connecticut where the mask policy was lifted, and a child was desperate to get a mask and did not have one with her, and the school did not have masks available for that child. So I would urge every school to have adequate masks for students. And I would urge all of the parents who are on here to teach your children not to bully those who are wearing masks, that you do not know what's happening for that child or in that child's family. And that is my concern, is the amount of anger we saw this week over masking or not masking makes me afraid that a child will be bullied for wearing a mask, and I would hate for that to happen.
Thank you, Member Wall. Thank you, Vice Chair Wall. Those are important comments. I agree. Any
Superintendent.
I wanted to reassure the vice chair that it is my intention to continue to have masks available for adults and children who would like them in the schools.
Thanks.
Thank you.
Member Deneve or Member Martini, we haven't heard from you this evening. Is there any? I don't want you to not say anything because this is your first virtual meeting and they're not easy to navigate. So I wanted to make sure that we checked in with you.
Well, I was just waiting for everyone else to be finished.
Please go ahead. That's
Go
not
ahead.
necessary.
Go ahead.
Whenever you're ready.
I'm really saddened that this has become such a political issue, because this is not about politics, and I feel like we need to reiterate that this is about public health. This isn't about a power struggle. This is 100% about sustaining healthy families and about supporting families and students. And there are so many people who wrote to us telling us how afraid they were because they're immunocompromised themselves or caring for vulnerable family members or have children under the age of 5. And while I agree that it's pretty farcical because we can't administer the policy and have students wear masks correctly and continuously, and as Glenn said, I don't think that that's a reason to abandon it entirely, because at least if we kept the policy in place, at least we'd have some masking, which I think is pretty critical. I really want to envision a summer without masks. I'd love to come back to school next year without masks. I don't like to wear them, but I think we're jumping the gun, and I don't feel comfortable with masks off. It really feels like people are not doing it because of the numbers, but because they're frustrated. And I hear that, but it's going to be awful if the numbers go back up. And I think that we owe it to the children under 5 to wait until they have vaccines and antibodies. And we owe it to our immunocompromised community members who are not, it's not about frustration and physical discomfort for them. It's about illness and possible death. So I'm not really satisfied with this policy as is. I can't support it myself.
Thank you, Member Deneve. I appreciate your comments. I understand your concerns. Other comments? I still can't see anyone.
Yep, Member Martini.
Yes, thank you. I want to just acknowledge all of the input that we have received, of which there has been a lot on all sides and everywhere in between on this issue. I do also hope that the community will stay just as engaged about other really important issues that we have coming. I feel that we shouldn't have a policy in place that is not effective or that we're not going to enforce. It doesn't make sense, and I think it sends a message, unfortunately, to students that since it's okay to disregard this school rule, that they can also disregard other ones, and is maybe contributing to the difficulties that that we've been experiencing this year. And so I would like us to be able to be more consistent for our students in school. That being said, I really do appreciate the thoughts and feelings that have been expressed by folks in the community, parents, and others about the safety of their young children who aren't eligible for a vaccine, people who are working with elderly or otherwise fragile individuals and need to protect them as well, or who have vulnerable family members living with them. And Christine, I know you've spoken to this so much already, but I was wondering if you could maybe just summarize for everyone again the other mitigation strategies that the district has employed and has in place, and in terms of ventilation and other things that are being used in the school.
Sure, I'm happy to speak to what we have had in place up till today. I will be reviewing the mitigation strategies, although quite frankly, most of them are really fairly easy to continue to implement. Some of those include the use of air purifiers in all of our occupied spaces, hand sanitizer, frequent hand washing, use of physical space. I'm trying to think of what all of they are.
There's the desks in the cafeterias. Did you say that one?
I think that's, yes, that's one of the mitigation strategies that the administrators and I have been talking about in terms of the feasibility of making changes in cafeterias. Certainly, any staff person who would like to arrange the furniture in their room in a particular way is free to do that. However, we will want to respect the students who still want to maintain some space from their peers at certain times. So we'll be talking about ways that we can provide opportunities for both students who are comfortable being not spaced and for those who still would like some space. So, but that's why I characterize it as use of space. So we will still continue to do our pooled testing and our contact tracing. That's something that we could have moved in a different direction, but our nursing staff had felt that it was still a valuable tool for us. So we're going to continue to do that. So, and certainly windows are able to be opened in classrooms as the weather is less than frigid, and can still be cracked on buses to allow increased ventilation. So those are some of the most common, frequently used mitigation strategies.
Thank you. Member Martini, did you have follow-up?
Just in terms of the equipment that the district has invested in, such as the air purifiers, work that might have been done on ventilation, what have you, are all of those things currently in good condition?
Yeah, actually, Christine, if you don't mind, I can start and you can fill in.
Yeah, please.
I'm actually really proud of how hard we worked at the beginning of the pandemic and what we learned about our facilities in that process. The first thing we learned when we were asked to evaluate our HVAC systems was that our central maintenance staff does an excellent job of keeping them inspected, cleaned, monitored, in good operation in all of our buildings. And we did have to do some repairs. We had full assessments done. We brought everything up to the air reading standard that we'd agreed upon was safe. And when we needed to get to that point, we employed the portable air purifiers, which we've bought probably hundreds of at this point for the district. And we are figuring out, I know we've discussed the investment in those have filters that have to be replaced. So the investment and the ongoing support of that. And we've also made minor adjustments in facility space when we couldn't get things up to the standard for air quality. But that, to my awareness, we didn't have to do a whole lot of that. And that was, if you want to fill anything in, Superintendent, the only reason I jumped in is because I know you weren't here for a lot of it.
I actually could fill in a little bit beyond what you've shared, Chair. I'm sure, Christine, you know, but
I'm good. You guys do this.
Get crazy. When we were doing all of the air assessments, we actually, in most cases, were beyond what was being suggested or promoted as the appropriate air exchange. There were very few cases, and understand we have a lot of rooms. There were far fewer cases or rooms than I, just as a general person, would have expected needed sort of extra boosting. And we did what we could to make it so that the air changes were happening that needed to happen, or did not use those rooms at all. There was no question for anyone. And since then, Superintendent, take it away.
I'm not sure I have much to offer outside of, I know that we've purchased filters for all of the air purifiers, and Mr. Heavey, our facilities director, referenced to me this week the intent to do another order for filters again. So those are being maintained at least for the foreseeable future. I do want to point out though that as we open windows, it makes no sense to leave the air purifiers on. Sort of the old adage,
Yeah.
you know, like if you leave your windows open, your parents would say, "Are you trying to, you know, air condition the whole outside or whatever?" It really would be pulling in more air than the air purifier is meant to support. So when we're able to open windows, we'll be asking staff to shut the air purifiers off.
Thank you. I think Member Martini, the question was originally yours. Do you have additional questions or discussion or follow-up?
A little bit. Are there funds that are that were previously slated for the purchase of masks that would be reduced at this point, needing fewer of them?
There wasn't any funding slated outside of our ESER money, and the ESER 1 money has been expended, so any additional mask purchases would be either allocated out of ESER 2, which has otherwise been allocated, so it would be a matter of prioritizing. We do still have a fair stock of masks, including the child size KN95s that you know, we purchased when the Department of Education sent masks that at first we believed were not well rated, and then we discovered they were well rated, but we had purchased some additional in the meantime, and unfortunately most of our kids don't want to wear them. But we do have them available, a couple thousand of them as a matter of fact.
Thank you. Member Martini, anything else?
Last thing, I
Sure,
noticed
that's fine.
that the proposed policy doesn't say anything specific about what type of mask that a student would need to wear if they had had a positive COVID test. And I am a bit concerned about the information that was provided by the Board of Health on Tuesday evening about what it sounds like a third of those students still being contagious after those 5 days. So it seems fairly clear at this point that cloth masks are really ineffective, and I'm wondering if we ought to be more specific about that.
I think in many cases, if we're to be more specific, which the committee certainly could, then the district may need to be prepared to continue purchasing that level of mask for some of our families. It's not a pro or con, it's just a statement. So if you choose to add any specific criteria for masks, I think that would just be something we need to be aware of.
Member Martini, are you asking to amend the motion? Are you just making a comment? Are you okay
Would
with
anyone
waiting?
else like to comment about that particular issue?
I think it's worth exploring. I wonder if we might pass it as is and bring it to the policy subcommittee meeting. Might not be before Wednesday's meeting though, but we could explore the budget impact. And I mean, it sounds worthwhile and a good investment and safety for our community. Why are we saying we encourage you to wear masks if we're going to make a message to say encourage you to do something for a public health reason? Then what we're encouraging people to do should be effective at what we're trying to help folks do. So that's where my mind goes.
If the children are refusing to wear the masks, though, what are we accomplishing by demanding that they wear the mask?
No. I don't think the proposal is to demand that they wear a mask. I think it's to keep the language the same in terms of recommending that people wear masks in certain situations.
No, what I'm saying is if we're going to say that they have to wear N95 masks and we know that they're refusing to do it.
We're not saying that.
Okay, sorry.
I'm confused then. What are you saying, Glenn?
Yeah, I am
I
too.
thought that's what you were saying as well.
Yeah.
The policy talks about recommending that people wear masks
Right.
I think the question was about
in
people
certain
returning for
situations.
the 5 days, right? Kate?
Yeah, I was specifically talking about that one part of it.
Right, specifically
which-
talking about those 5 days when they return and they could, or very likely are still positive, and providing a specific type of mask for them. That's what you were asking?
Right.
Yeah.
Being respectful of the community
Sure.
members who are going to be uncomfortable with this mask policy being essentially lifted, and knowing that there will be some COVID positive kids in school who will be contagious. I just want to make sure that we're providing the best possible
Well,
protection that we can. And
I appreciate that, and I think it's an important thing to discuss, so I'm glad you brought it up. I guess my thought is, at this point, I think it sounds like from the folks who've already spoken, we kind of want to just pass it as is for now. We meet on March 9th. We meet again on April, around there, 8th or 7th or whatever it is. And so we do have an opportunity to make adjustments as the situation changes. And, a lot of this, I think, we're passing the change now on a wait and see attitude about a lot of things, not just that. I think it would be helpful that if the nurses, the school community, who's dealing with folks returning for those 5 days, that they may still be contagious or having trouble with um, compliance with the policy and would like us to change it, we would want to have that feedback. I think that's how I would want to address it. But I'm open to further discussion for sure.
Amy, I have a
Member
question.
Deneve?
Yeah, I'm sorry. No, Amy, you can't see me.
I can't see anybody, sorry.
I'm
Go
raising
ahead.
my hand and I'm realizing you can't see me. I had a question kind of piggybacking on what Kate was asking about those 5 days. So if you're contagious and you're returning to school and you're having to wear a mask, and then after 5 days you're okay taking them off, how do we know if they're still contagious? Is there a
We don't even know that they
test?
are contagious when they come back. It's based on research.
So is
It's about
anybody
a third of them that may be contagious when they come
okay?
back.
So is anyone coming in with a negative test in hand? Is that something that's worth discussing? I mean, because I think that's kind of important because I know that people are not reporting. They're not.
You can't necessarily test negative if you're still in the period.
That's right.
So
that sort of proves the keep the mask on point. I mean,
it absolutely does. We've seen how the school communities have fared in masking, and it's very clear from things that are happening locally and beyond that people are expecting change, and this is one change we have not yet tried. I don't I will go with whatever the committee wants to discuss and move forward with, but I don't think there's much interest in making any of this very granular in terms of requirements at this time.
May I
Please
say something? So that when the and Mayor, you may know this, Superintendent, I'm certain you know this. When the Department of Public Health is notified that someone has tested positive, if it is a student or a teacher, that information is made known to the nurse at the school district. So they, as the nurse in the district, again, tell me if I'm wrong, but this is my understanding, the nurse is able to monitor, okay, you got notified on this date, then we have X time, and this is when it would be acceptable to no longer wear a mask. It isn't, so there isn't someone who's out positive that public health is unaware of.
Well, there are.
So I'm doing air quotes because it's all gotten so confusing. But if we know about it and the Department of Public Health knows about it, then we are able to do those extra measures.
So one thing I'd like to share that in guidance from the Department of Education, which was updated as recently as February 18th that I've seen, they recommend that a return to school should be based on time and symptom resolution. They do not require a test to return back to school. And there is concern that after a positive test, people could continue, especially with a PCR test, to test positive for a significant amount of time after that. So it's really based on symptom resolution. So we would certainly, our nurses follow up, they are in contact with the families of students who we know are positive. So it would be a medical conversation at this point, at that stage of the game. But again, that's not necessarily any different than what's been occurring to this point, that our nursing staff follows up with students or staff who have tested positive.
Thank you. Again, I still can't see anyone. If there's further discussion, please go ahead. I'm not hearing anything. I'm about to move to a vote.
Go ahead. I'm not seeing anyone say anything either.
Okay. So we will move to a vote on adopting the new policy. We will do, as we always do in a remote setting, a roll call vote. Secretary Ekstrom, would you be so kind?
Let's have Susan Farber read back the motion so that we're all clear. Not the whole thing again, clearly, but the motion that was put forth. Susan.
Oh, can you unmute her?
I can't find her.
Let's see her either.
Oh, there she is.
Oh, there we go.
Oh yeah, okay. Okay, Susan, there you go. You're unmuted.
I can do that, certainly. As I read it, I am recalling comments earlier about specifying that this is a passed on the first reading, that guidance. But currently the motion reads to replace the current policy EBCFA face coverings with the revised policy as of March 3rd, 2022.
Thank you.
And so what that means, what we're all agreeing is that what that means is essentially it's up to the individuals to make their determination unless there's something publicly known.
What are you talking about?
It's the policy that was written that you read to us.
Right. Oh yeah, no, I know. Yes, I'm trying to clarify for everyone.
Can we amend it just to say that we're adopting it effective immediately on an emergency basis?
Why is it an emergency?
Well, if it's not an emergency, then we can't pass it on a first reading. We only pass policies on a first reading if it's an emergency. That's what.
Not if it's a vote of the whole committee.
We have a policy about the adoption of policy, and the policy.
And it specifically states it has to be an emergency.
I can read the language to you if you want to just hold on in just a second.
Please.
It'll take me a minute to get there.
I just don't recall seeing anything about emergency. You're sure that's the right word?
In an emergency situation, the committee may adopt or amend on the first reading. In such circumstances, the policy or amendment should return a second time for affirmation of the emergency policy decision. Policies will be effective upon the date set by the school committee or as soon as is practicable.
Fascinating. So let's add to our policy discussion to change that language. I think emergency sounds a little ridiculous, but okay, we'll say it's an emergency.
We are in a public health emergency that has not stopped.
Okay, sure. The irony of passing something to get rid of masks while we're in a public health emergency, not lost on me, but we'll keep going.
No.
Are we ready for? So are we clear on what we're doing?
Emergency.
We're passing an emergency, waiving which puts it in place in the first reading. And Susan Farber has read us the motion, so we know what we're voting on. Does everyone feel like we're clear on moving forward?
Yes.
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 So let's do a roll call vote, please. Secretary Ekstrom.
Member Johnson-Musad,
Yes.
Chair Poyetti,
Yes.
Mayor Weigartner,
Yes.
Secretary Ekstrom, I'm also a yes. Vice Chair Wall,
Yes.
Member Deneve,
No.
Member Martini.
Yes.
We have a quorum, majority of
6-1.
yay. Yes.
Yeah, so the motion passes,
Yes.
effective immediately. I want to thank you all for your work on this, and then I would like to ask for a motion to adjourn.
So moved.
That was
Second,
the mayor.
Johnson
And a second,
Musad.
I was Member Johnson Musad, and we'll do a roll call vote for adjournment.
Member Johnson-Musad,
Yes.
Chair Poyetti,
Yes.
Mayor Weigartner,
Yes.
Secretary Ekstrom, I'm a yes. Vice Chair Wall,
Yes.
Member Deneve,
Yes.
Member Martini.
Yes.
We are adjourned.
We are adjourned at
I know.
8:31. Thank you, everyone.
Thank
Thanks,
you.
everybody.
Good night.